And so you don't feel like you're just listening to a computer screen. I just wanted to say hello quick and pop on the video for a minute. I'll come back on towards the end as well. But welcome to our second official session for our DSDN parent webinar series. We're so glad that you are here. I'm Jen Jacob, and I will be presenting tonight where we'll be focusing on navigating the first 3 years in your parenting journey with a child with Down syndrome. So very excited to see you all here tonight. We've got quite a group going, so that's great. We know that most of our parents will access this later on through our online resource library, and that's wonderful as well. I will show you here near the end where you can access that on our website. And as I said a few moments before we started the recording, that we hope to have everything up and online in May for you to be able to view and check out. So look for those things coming soon. Everybody who registered for the webinar series will get an email to let you know that those things are all ready to view. Otherwise, we'll post about it on our social medias and send out some messages through email as well. So we're very glad that you're here tonight. Like I said, I am Jen Jacob. I'm currently the executive director and co-founder of DSDN. I also got a chance to write a book a few years ago. And so that's partially what this content will be surrounding tonight, is following parts of the book through. A few objectives that we'll kind of cover tonight, if you're wondering what things we'll be looking at. We'll be really focusing on those first few years, talking about medical guidelines, understanding some of the differences that you'll see when you start creating some school-based plans and goals for your child, especially through IFSPs and IEPs. And we're going to be just looking at lots of resources. This will all be available for you later online too. So if you don't get everything, let me know, and I'm happy to send you copies or links to anything along the way as well tonight. So please feel free to pop up in the chat and ask a question, or raise your hand if you have something that comes up along the way. Otherwise, we'll leave some time at the end for Q&A as well. Some key things to remember that I always like to really start out with when we do this presentation is that you really are your child's best advocate. In this whole journey, you really are a key. And sometimes it doesn't feel that way, but you truly, truly are. So don't forget that. Also remembering that your family's journey is that it is yours, and it will not look the same as everyone else's, but you will find some common threads and commonalities and similarities, but everybody really does travel their own path. Parenting is a marathon, not a sprint. This is something I need to remind myself often. And maybe if you need that reminder tonight, I'm hoping you hear that too. And taking care of yourself is very important, especially for parents and caregivers in this community. These are key things as you start along your journey. So in the beginning, this was a piece that I love to share, and there's a great video that goes along with it as well that I have a hard time getting downloaded these days, but wanted to share this with you guys. This is an elevator, and there's a great video about some people trying to get up the, escalator, good gravy. The escalator is broken, and they don't know how to navigate that. And so you see this couple standing on the escalator, and they just cannot figure out what to do now that it's broken. And I think sometimes that's kind of how I felt at the beginning, that it felt like there were some easy answers that I just wasn't seeing. And part of it was just starting to use my common sense a little bit, but I'm an overthinker, and I don't know if anybody else is here tonight, but you know, overthinking things sometimes, and just remembering, go with my gut, think about it, look at what's around me, what resources. Oh, even if that escalator is broken, I can probably just walk up it or down it and still get to where I need to go. Might take me a little bit different way or different time, but I'm still going to get to those goals. We're going to talk a little bit about some prenatal pieces here. And I wanted to tell you just a little bit of background. I think that slide is missing here somehow, about myself. I am Jen Jacob, Executive Director for DSDN. I wrote a book a few years ago called The Parent's Guide to Down Syndrome. And that book follows your journey in parenting from pregnancy all the way through adulthood. My co-author is Marjorie Sikora. She's amazing and has an older son with Down syndrome, Marcus. And she and I worked together to kind of craft like what would be really helpful for parents to hear at the beginnings of all of this and in manageable pieces throughout all the stages. We've included tons of resources and tools and strategies and just all sorts of things in the book. So it's a great resource if you're looking for some kind of manageable bites of information to kind of go through the rest of the stages as well. My son, Owen, is 9. So we're at an interesting point on the journey as well. I feel like we were just pregnant yesterday, but we're a little bit beyond that now. So it's nice to have a little hindsight. We've been running the DSDN group since he was just a few weeks old. So I've literally been able to walk alongside thousands of families in this journey. We serve over 18,000 families now in DSDN groups. So all of this information is really collected with a lot of that, the resources and research and what we've seen in the groups and from real families. So we hope it's helpful for you too. I'll talk just a minute about some of the prenatal things because we do have some families that might be joining us tonight that are from our pregnancy group. And I think this is really helpful for those of us to know what's going on, especially if you had some prenatal testing done. I think it's really important for people to understand the 2 types of testing in our field that you might have access to. So we have screenings or diagnostic tests. The screenings are things like ultrasound. They might do a nuchal translucency scan where they're looking at the back of your baby's neck. They might do cell-free DNA testing or non-invasive testing, or NIPT is what it's often called. They might also do other tests like quad screens or the serum screenings. Those all on that side are all screenings, which means they're not a positive diagnostic test. They can give you a likelihood, but they are much less reliable than a diagnostic test. The 2 primary diagnostic tests that we see most often are CVS and amnio. Those are both done at different points of your pregnancy. The CVS is done much earlier than the amnio is. Both of those have about a 98 to 99% accuracy rate. So if you get a positive test result from one of those tests, you are likely, you can trust that result much more likely. Some of the screenings are becoming much more reliable. And so those are things to really kind of look at as well. But talking to a genetics counselor or talking to your OBGYN are excellent resources to really understand what testings you've had done, what screenings you've had done, to really understand what those results mean for you and your family. Like I said, resources that you can talk to your genetics counselors. If you're at a specialist or if your OBGYN is referring you on to a perinatologist or an MFM, maternal fetal medicine specialist, those are excellent resources as well. If you have a local group, they can be a wealth of information in lots of areas. And this might be a place where they can really help you kind of understand those tests or screenings and also maybe talk to local physicians or doctors about what's going on there as well. I just had a chat pop up there. Sorry, guys. This is all kind of in a little wonky space on my screen. And I know somebody asked where we'll find all this later. All of this will be available in our online resource library. So I'll make sure we pop that in here at the end again too. Continuing on about prenatal resources, the National First Call program is an excellent resource. It's through the Massachusetts Down Syndrome Congress, and they support families who are just getting a brand new diagnosis and maybe really want to talk to other parents. They might want to talk to their genetic counselor. They're a wonderful resource for you, especially at the beginning. Obviously, DSDN, I believe, is a really strong resource as well. So that you're aware, we do offer a pregnancy group for women who are expecting a child that is likely to have Down syndrome. And then we also offer a dad group where dads can join other dads who have children with Down syndrome. So there are some great resources there right at the beginning. And also you can check out Down syndrome pregnancy.org. That website is through Lettercase through the University of Kentucky prenatal postnatal program. And they have excellent resources that go beyond Down syndrome, but have things for and materials and resources for other conditions as well that you might find out about within a pregnancy. The Down syndrome pregnancy resources are great. They have lots of books that you can look at and resources that you can check out that are really specific to that Down syndrome pregnancy. Another resource that I really love for brand new families is this prenatal care guideline set from Canada. We don't quite yet have this here in the United States, but it is a resource that you might check out that has a really great set of not necessarily guidelines, but steps to kind of follow through and things to consider and talk about with your doctor during your pregnancy. It could be different tests and things that they want to be looking at throughout your pregnancy, and just different things that you might check out along the way, especially if you are maybe early on in your pregnancy. At some points, they'll want to do an anatomy scan and kind of check different things out. They might want to check for heart conditions, for GI concerns, and just really watch how things are going with baby in your utero. So the Canadian Care Guidelines are a great place to start and an excellent kind of jumping off point to talk with your doctor about as you plan for your prenatal care with a likely diagnosis. And like I said, there are so many supports out there for you. I really hope that you check into those things at any point. I know everybody kind of feels differently. At the beginning, I kind of wanted lots of information, and then I kind of reached a point where I didn't want any information again. So I kind of wavered back and forth between the two. So I had a great mix of talking with people locally, being in online groups, talking with people who were at the same stage that I was. Reading lots of blogs, and out now there are just so many different places to look, blogs, within different programs, even following people's Instagram accounts or Facebook pages. There's just so many things out there to see parents, families, journeys, and stories. It's a great resource. Lots of books to check out too, if you're into books. And we have a lot of that in our resource library as well for DSDN. Here's what we'll kind of dig into after a baby is here. Here are some things to really kind of think about in those first few months. I think one of the big things to think about in this first stage is that it gets busy. I remember feeling like we were just going all the time. And when you have a newborn and just bringing a new child into your household, whether it's your first or your fifth kid, it's just a whole different scenario as you kind of all get used to one another and figuring things out. But that first stage can be really kind of intense, for lack of a better word. Some of the things that you might think about here. Oh, sorry, I went ahead to slide there. This is a set of guidelines that were put out by the American Academy of Pediatrics. And this is actually several years old at this point. And I know that they are working on updating it, but it's just such an awesome resource for families. And it breaks things down from when you're pregnant through all the way through adulthood, and things that we should just be kind of aware of and looking out for our kids with Down syndrome. They might be susceptible to some more conditions and things that are more likely to happen with them. So just kind of being aware of it and talking with your providers about it is great. I was really pleasantly surprised after my son was born, and our pediatrician, who we'd been with all of our pregnancies, she broke out this set of guidelines and was kind of talking through them with me. And she actually did that at each of his appointments. And I felt like it was really helpful. It was a nice guide for both of us because she didn't have a lot of patients with Down syndrome. And so this was an easy way for her to kind of check off things with me as well. But because we loved our pediatrician, I felt more comfortable as well, knowing that she had that guide and resource to just help us along the way. So it discusses things like blood tests that you might have done at certain points, different specialists or things that you might need to look at and talk about, just all sorts of things that you might want to consider along the way there. One of the things that pops up in those first few months might be things around these different therapies. And I really didn't know a lot about any of this, and there's a lot of acronyms and names that might be thrown at you in those beginning months. So this is kind of a little bit of decoder for you. So some of the therapies that you might talk about are physical therapy, occupational therapy, or speech therapy. Physical therapy can really help your child with lots of the gross motor skills, crawling, walking, rolling, a lot of those big muscle group skills. Occupational therapy, I always think of as the more fine motor skills. So helping a child grasp things, eat things, work on all those little fine motor, small muscle group skills. Speech therapy is not necessarily for when your child is talking. I was really pleasantly surprised to learn more about this as Owen was growing older. We didn't seek out speech therapy right away. And I almost wish we had started talking with someone a little earlier on this, because there are things that a speech therapist can help you with and kind of help look at with your child and evaluate and just give you some advice and thoughts, even before they're speaking. So speech therapy can be a really big piece for our children as well. Some resources and things to think about in the area of therapy here and education. Early intervention programming is probably available in your state. It might be through your school system. It might be through a waiver system. It might be through your hospital system. So you just need to kind of check into that. Each location and place around the world is a little bit different with how they handle this. I love the website Parent Center Hub. It has a lot of great resources and places for you to click into and just find out kind of what's best there for you and your child. Therapy options even get started talking about here in those first few months, because you might choose to do things that are based within your school system, even before your child is in school. Or you might seek out to do private therapies on some way, shape, or form. Or you might choose to do neither of these things, or a mix of them, or, changing throughout your time. There really isn't a perfect answer for this. It's just kind of checking out what your child needs, what you think might be a better offering for them, talking with those professionals, and really seeing what's a good fit for your child at that time. And it surely might change over time as well. So that's a good thing to just be kind of aware of as you get going. Some things you might notice in this newborn stage. Some of the things that I definitely noticed is that your baby might be a little more sleepy than a typical child. They might not pass their hearing tests. You might notice gunk in their eyes. You might notice looser joints. These are all things that are very common for our kiddos. The not passing hearing tests and the gunky eyes really go a lot together. Something I learned after Owen was born was how their little tiny ear and eye canals just kind of get a little gummed up, I guess, for lack of a better word. They just don't flow as easily sometimes with fluids and earwax and all of those things. And so it can take a little bit longer for those canals to grow out a little bit and really get some movement going there. I know that some kiddos do end up having a surgery in their tear ducts to help with some of that. Many children, I think, end up getting ear tubes to really help with all of those pieces as well. We were sure that Owen was going to be getting hearing aids because he never passed a hearing test for almost the first year. Then we ended up getting hearing aids, we ended up getting ear tubes. And a few months later, we went in to check and things were still not moving quite as we hoped, and ended up going through the process to get hearing aids. And the day that we were supposed to have his hearing aids placed, they ended up checking and finding some wax and kind of taking that out. And they did the screen and the hearing screen again, and he was finally passing things. So for us, that was just an important reminder that we needed to really have a great relationship with an ENT, an ear, nose, throat specialist. So that way we could really be monitoring that earwax buildup, because for him, that was key. We wanted him to be able to hear as much as he could through those ears. So the ear tubes for us and the wax cleanings regularly really were helpful. Loose joints is something that was really interesting to me to learn about. And when I look back at Owen's baby pictures, it's super clear. They talk about low muscle tone with our babies pretty often. Hyptonia is the official word for that. And I think when I heard that initially, I thought it meant he'd be not very strong. But I came to find out pretty quickly that no, he was a strong little guy. He had great muscle strength, but his joints were just different. And so I noticed this most often, like when I would lay him on his back, his arms and legs would just kind of fall to the sides, like they weren't real structured yet. He didn't have that kind of torso strength or whatnot. And as he got older and has been moving that's become more strong for him too. But loose joints and low muscle tone definitely do not mean strong, because he is very strong when he wants to do things. So just something to keep in mind there as well. Some things to really consider in these first few months as well, what those increased risks might be for your child, things to be looking for, if something pops up, maybe not to ignore it like you might with a typical child, or just give it more time, especially if it's something that might come up on those healthcare guidelines. So talking to your providers and specialists are really key. Also having some of those medical providers and specialists in your pocket at the beginning, to really have a good relationship with them and have somebody that's willing to answer your questions and look into things. One of the most frustrating things I think I find and have found with other families is that sometimes a medical provider might discount whatever you're saying to them about what you're seeing with your child, because they just consider that all part of Down syndrome. And I would just really encourage you to think about that when you're talking with medical providers. Down syndrome is a diagnosis of a genetic condition that our kids have, but it doesn't explain away everything that might be going on with them. For example, you might see something going on and they don't look into it, or do look into it and find that there's things going on with their thyroid. That's something that can be treated, that they can work on. It doesn't just come along with Down syndrome. There are things that you can do to help support your child. So that was one of the big advocacy things that I think I learned about at the beginning. I've also mentioned here the Down syndrome clinics, and this is a picture from the Global Down syndrome website, and they have a list of all the Down syndrome clinics that you might find across the US. A Down syndrome clinic is a specialized place that you can go and talk to somebody and kind of get evaluated. They've got a little bit more information about Down syndrome generally than your typical providers might, and can access other resources for you potentially. So this is something that you might take your child to for all of their care. This is something that you might go to for a reference point, at the beginning, to kind of get some baseline information and resources. I think each family kind of uses these differently. And it's really up to you whether or not you want to use this resource, obviously, just like everything else with your child. And I know there are some Down syndrome clinics that you can do online now as well. So there's just so many opportunities for you to talk with other specialists about raising your child. Some other things to look at and consider here, state-based programs that might be available to you and your family because you have a child with a Down syndrome diagnosis. You might have waiver programs that are available that might help with some funding or Medicaid, Medicare types things. They might be on waiver programs that offer other services or respite care or paid activities. It's very different for each state. So I really encourage you to talk to your local organizations about what that could look like, or talk to other families in the area who have older children. I wish it was an easy answer there, but it really is just very, very different each state. I also love this medical care binder, especially at the beginning. This is something that you just start to accumulate a lot of paperwork, as you do with any child. We had an older daughter that was in the NICU, and I remember the amount of paperwork that we came out of there with her. And so I kind of knew that some of this would be coming along. But anything that you want to keep track of for resources, whether it's medical care or even later on for schooling, having a way to kind of organize all of this is pretty helpful right at the beginning as well. We're going to dig into the next little chunk of time here for 6 months to 2 years and what kind of comes after. Like I said, those first few months are one of the times where you are digging into everything. You have a lot of things to check off your list, a lot of specialists that you might want to talk to for vision or heart or thyroid or ENT. I feel like after 6 months is when you can breathe a little bit, depending on what's going on with your child medically. But you can kind of think, okay, we're in a system now. We get to know you. You've gotten to know us. So here's where we're at in the next stage. Again, going through this with your medical providers and just talking about, okay, what do we look at in those next few months? What things should we be seeing? In those first years, you're just at the doctor's office so much more, even for well child visits. So this is a great resource for you to just always have with you when you're having those conversations. When we think about therapy and education in that next piece of time, I would say it's really about finding the right balance, because you could probably find ways to get your kid into a therapy and a program and a process for every minute of every day if you'd like. But that might not be the right fit for your family and might not be the needs that you need met at that moment. So I just encourage you to find the right balance and really go with your gut on that. And you might change up your plan many times, and that's absolutely okay. Finding the right fit for therapy and education is also really important. And in each state and area, I think this is very different. Here in Iowa, we have more of a coaching model with our early access programming, where they send professionals over to you to talk about your child and kind of get some baseline data, and then give you some activities to do, some resources, and then kind of touch base with you regularly. There's other places that you might have a more direct instruction model where the provider is there actually doing all of the therapy work with your child, potentially with you there or without you there. So just figuring out which of those you're comfortable with, which ones help you support your child more and support your family better. Also getting to know the community and figuring out, what resources and activities are out there for you to get involved in that might be therapy-like things, but not an official therapy session. And for example, if you have a Gigi's Playhouse near you, I know ours always offers different programming throughout, starting at a very young age. And, that's not necessarily an official therapy, but they do all sorts of activities. They have parents and leaders that will help you with all sorts of things to help your child learn and grow. This is one of those things that you might see several times throughout your parenting journey, especially if you have little ones. And I just wanted to kind of touch base a little bit on this. We're not going to go super in depth on this. At the beginning of May, we will be having somebody from NDSS come and talk to at our parent webinar series about the differences between IFSP and IEP. When you're in these early stages, you will be working with an IFSP. So that's an individualized family service program. And so this is really happening at the beginning stages, either through your waiver program, through your medical system, or through your school, depending on how your local agencies are set up. And this is really what the earlier intervention looks like for your child and works them. You get a chance to get to work with them before your child is eligible for the school-based programs. And at the school age of 3 is when that officially happens. This is really a way just to kind of look and see where your child's at developmentally currently. They provide you the resources. They might be able to give you some coaching or some tools. It usually happens in your home, or at least it did pre-pandemic. I know things have shifted a little bit. Some I know was virtual over the years as well. But you work with this small team and create a list of priorities and concerns that you have, and then they use that to guide and give you some resources and tools as well. It's not as in-depth as an IEP, an individualized education program, which happens once your child is in school. But this is more looking at those early skills and behaviors and what your child is doing and how they can help support you during that. I know it's a really big piece of the puzzle. It does feel a lot less formal than an IEP. And in fact, I don't even think I really realized this is what we were doing when we first did it with our social worker and physical therapists and our OT when we were at the beginning of this, but we got a nice document that came out of it that gave us some baseline information. And then we had some things to work on and ways to try some things out with Owen or your own child. One of the things that I felt like was really helpful, and I believe this was from the NDSS website, is this milestone chart, which is a little bit, I feel like it was super helpful, but also a little worrisome at the beginning. I think one of the things that I want you to see is look at that range at the beginning for typical children and for children with Down syndrome. I want everybody to remember, which this is what I think was hard for me to remember at the beginning, is that it really is a big range for kiddos. And, you know, regardless of if they have an additional diagnosis or not, kids just often do things on their own timeline. And I don't think that's any different with our children. But one of the things that I learned early on in this process is that it just sometimes takes our kids a little bit longer to do some of the things that a typical child might do. That's exactly how we explained it to our older children when we knew we were expecting Owen. And after he was born, and we shared that he had a Down syndrome diagnosis with them. Now, we shared that with them. And then I think like the next day he rolled over. And so the kids were like, Mom, I thought you said it would take a long time. And, you know, of course, I was lying already to them about the things, but you know, some things do take a little bit longer. I've really found in seeing so many kids over the years that some kids really have stronger skills in some areas than others and kind of have their little groove. For example, Owen was very strong in his gross motor skills. He, you know, sat and crawled and walked in kind of all of the really typical-ish range. It wasn't too far off of that. For him, language has always been our challenge. And so that is still coming along very much. Still, even at 9, we're still working very much on his speech. But this is just something to kind of keep in mind, because I think it is helpful to know. I do think it's frustrating sometimes to think, oh my gosh, are we not there yet? But yeah, it gets there, but some of the things just feel like they take a little bit longer. But I promise when you're in it and you're watching your child still make progress, I think that's still hopeful. You feel like you're still kind of working along their curve. Some things that are really important to consider here in this stage are all about sleep studies. Number one, that's something that's really recommended for us to do for our kids, because sleep apnea can be a pretty big condition that our children have. Additionally, that oftentimes kiddos have their adenoids or their tonsils removed to help with some of that. Some children are on CPAP machines or oxygen support at night. But I really feel like this is an important piece to think about with your child, because, you know, if somebody's not getting great sleep, that really impacts lots of their day. And so it's something just to really be aware of. Thyroid can be a big thing as well now as your child's getting a little bit older. I think a lot of people do a lot of the blood work around this when they're doing their checkups, and you might see an endocrinologist to help you with some of this and track things. Most of our kids, I think, respond really well to medication or supplements if that is helpful for them with a thyroid condition. So just something to be aware of, and what the symptoms to look for might be for hyper or hypothyroid, either one. Tummy time. This is something, you know, when we were talking about that low muscle tone, but still being so strong. I mean, Owen was like crazy with tummy time stuff. He didn't love doing it, but he really did get really so much stronger, I feel like, through doing that. One thing I love to remind parents too is tummy time doesn't have to just be on the floor, you know, in front of their little toy or whatever that might look like. We did tummy time a lot, just even on an incline, whether it was just Owen resting on me while I was laying on the couch or sitting on a chair. Any of that in those stages is really helpful as they develop those muscles and muscle control. So tummy time can look a lot of different ways. Straw cups was also something that was really interesting to me that I learned about when Owen was little. And it was actually, I don't think until we saw one of the speech therapists that they mentioned this, but because our kiddos can have those looser joints and looser muscles, mouth muscles and tongue muscles really need to be worked a lot to help with that speech development. And so they were saying how important that straw cup can be, because as they're working those muscles to use the straw cup, that can really help them develop those mouth and tongue muscles as well. So I know there's lots of straw cups on the market. I think we owned every single one of them at some point. I know there's special cups that you can buy through places as well. And I think it really is just a trial and error piece of what really works well for you guys. I know for us, we found the ones that had a weighted straw kind of on the bottom in the little sippy cup. I loved that because Owen was also a thrower of things for a little bit of a time. So anything that had a lid was great, but the weighted straw cup really was helpful. Then we transitioned more to kind of like those take and toss cups that just have the lid and then a regular straw. And then you can kind of help squeeze the side of the cup, which I think is kind of what the Honey Bear does as well. But just kind of looking at it and seeing how that works. But straw cups can be super helpful there too. Some things to consider for healthcare for your child during this time. I'm not even going to say that word, the AI test. That has to do with their neck and what's going on in their vertebrae. And I know that the American Academy of Pediatrics has changed their stance a little bit on this over the years. But it's just something to really be aware of with your kiddo. And if you start to see something that just doesn't seem right to you or seems off, that's a really great thing to dig into a little bit. I also believe that before a child starts to do Special Olympics, I think that they require that test to be done. I think it just consists of an X-ray that they do just to check their vertebrae placement to make sure everything's lined up the way that it's supposed to be. Dental work during this time can be really important to just kind of start them down that path of going to a dentist and what that looks like so that they have great oral care during their life. The ophthalmology piece is really important here too, and that comes up in the healthcare guidelines. Many of our kiddos need glasses for some corrective work, and I know for me, this was one of the things that I was like, well, he's not really talking to us. So how are we going to know that he needs glasses to see better? But they have some great tests that they can do and ways to get some of that information from the kids. So we have found it to be super helpful. In ENT, like I said, I feel like they were one of our best friends during those first few years, just as we got through all that hearing piece. And, monitored his tonsils and monitored ear wax and ear canals and ear tubes and all of that. So they're a great resource because our kiddos, have those tiny little canals. Owen was really susceptible to croup. And so almost once or twice a year, we would surely start with that cough that all parents know if you've had a child with croup before. And we actually had a great relationship with our ENT and pediatrician on this. And if we noticed it, we would bring him in, they would give him a little dose of the Decadron. And we actually never had to go through anything additionally with a hospital stay with that. But it's just one of those things to just kind of be aware of with your child. Nutrition is a big thing during this time too. And obviously everybody kind of does what is best for their family, whether, they're using vitamins and supplements or using table food, more soon breastfeeding, bottle feeding, whatever that looks like, just really kind of starting to look at all of that. There are lots of options out there. And I would just really encourage you to kind of dig into that and see what's best for your family. The other thing that I will mention here that I thought I added to this slide, so I'm sorry if it comes up later, but something that comes up with our kids sometimes too is something called infantile spasms. And I just want you all to be hearing that, especially if you have a little one, that if you notice something that's off with your child, I just really encourage you to always reach out and talk to your doctor, share what your feeling is, because something like infantile spasms, which are some seizure-related activities, our kids are more susceptible to that. It's still not a huge number of children that go through that, like kids with heart conditions, that's about 50% of our children that may or may not have something heart related. The infantile spasms number is much smaller, but it is something that definitely requires early intervention and treatment. And our kids do really well with the treatment. But, if it's one of those things that you put off or you don't think is something that you need to dig into because you're maybe a little even afraid of what you see going on with your child, I just would really encourage you to advocate for your kiddo and talk to your doctor about that. Something else during this time too that happens. Oh, I'm so sorry, you guys. I think I cut out there for a second. So something else that's going to happen during this time is that you'll start to see a shift to school-based services. And what I'm realizing is that I think my slides are skipping tonight, you guys. I'm so sorry. And I think I might re-record this as we go. We're going to zip back. So that was our slide that missed. Sorry, guys. So we're into the 3 to 5 years. That's why it looked a little strange. So, you know, all of those things are after your kiddo is hitting that 3-year stage. When your child hits 3, this is kind of the magical number for a lot of services that are going on. And when you hit 3, you have that IFSP that we were talking about earlier, and we'll start talking to your team about what that looks like when you shift to the actual school-based services. You might be seeking out private therapy still or not at this point. And then you do have some more options that open up to you. We talked about Gigi's Playhouse a little bit earlier that does offer programming in most areas for young kids and their parents right away. A lot of their programming and services kick up a notch as your kid gets a little bit older. So this is something to look into. Many areas around the country also offer different sports activities that you can do with your child. Miracle League is one that shows up here pretty often. And that's different sporting activities, maybe baseball, maybe soccer. It just, I think, is a little different each space. And then Special Olympics, they have several different programs. They have for young athletes, they have for older athletes, and they also have a new program called the Unified Program that pairs children and people with special needs with typical people as well. And so there are just so many different programs to check out and look into. So as your kiddo is getting older, these are things to just really look into and ask your care providers about or your school-based providers about, because they'll have all the resources for you. Pediatricians are a great resource for some of this as well. This is one of the things that I just highly, highly recommend. And in fact, I believe it is, oh gosh, I think we're on the 28th, April 28th is when Dr. Stein, the author of Supporting Positive Behaviors in Children and Teens with Down Syndrome, will be joining us. This was a book that changed our life here in our household. It really talks about helping your child through behaviors that might be challenging, because I do think that that's maybe one piece of this puzzle that is a little bit different for some of us raising our child with Down syndrome. Some of the behaviors that come out can be interesting in some ways, but I feel like reading this book helped me understand Owen so much more and gave me some really, really excellent strategies to try with him. The book's called The Respond But Don't React Method. And at first I couldn't even get my head around that. But as you start to kind of look through it and hear the ideas, it really made so much sense and truly made a difference for our family. One of the biggest things that I learned is about behaviors and just how to give some options and make things a little less stressful for Owen and for me. This was also a book that I always gave to our schools each year. Like whatever teacher he had, I made sure that they had a copy of this, because I feel like it's really easy to read, very friendly to especially educators who are used to just providing lots of strategies and tools over the school year anyway. But some of the behavior strategies that it talks about is giving children choices like if, then. So if you finish this activity, then we're going to go do this. So most kids, if they're like most adults too, like their preferred activities, but sometimes we need to get through certain things. So Owen does great. If I tell him first, if you can get your teeth brushed, then we are going to go read our books before bed. So he knows what's coming up. He knows what's expected of him, and it makes it so much easier for all of us. Choices is the other thing that I feel like is kind of one of those things that I wasn't utilizing enough as a parent, and often giving them choices that all the things are acceptable and get me to my end goal, but might make things feel a little bit differently for him. So giving some of that control over so they can practice independence. And that don't react piece, it's responding, it's like giving an answer, but not like freaking out. For example, I'm sure Owen will love me telling this story someday. Once we moved into our new house, he thought it was hilarious to grab a steak knife off the counter from our butcher block. And, when a child does that right away, I had all levels of panic most of the time when he did it. And of course, I don't know, maybe I'm not like every parent, but my first reaction was, oh my gosh, put that down, screaming, yelling, chasing after him, to which he thought was hilarious. And he'd run with it. And then, he thought it was a game. And that was about the time that I found this book, honestly, because it made a huge difference for us. So for that example, the responding but don't react was, oh, I see that you have the knife. Why don't you put that down over here on this counter or over here on this counter? I didn't chase him. I didn't run. I didn't raise my voice. He knew he wasn't supposed to have it. He knew what the expectation was. And sure enough, within a pretty short amount of time, he knew that he was not going to get me to react in the way that he really wanted me to. And so he just stopped doing it. So just a little piece of advice on that it really was very helpful for us to read and learn about all of that. Some potty training things that you might notice too, especially if you've potty trained other children. I found that I was ready to have him potty trained. He was our fourth kid. And so I was kind of done with diapers at that point of our life. And we tried potty training several times, and it really was hard for me, especially because until he was ready, it wasn't going to happen, until he kind of decided that this was the way it was going to be. Once he decided that he was ready to get on board, it really happened pretty quickly for us. But also, our family, he didn't have a lot of medical conditions or other things going on. So I know that can be very different in everybody's household. So something to just think about. There are some really cool programs out there too. I'll link to that here in a little bit as well. Some things to consider when you are in this stage. I found some of these resources to be excellent, especially as you were starting down that school age path. Wright's Law was an awesome resource. It has all sorts of books that you can read to really understand what special education law is about. It has books about IEPs, Emotion to Advocacy. I found these 3 books especially helpful, but it can be an excellent resource depending on what questions that you have as you're getting through that first onslaught of IEPs and making that transition into the school district. I also really encourage you, especially if you don't have a strong background in any of this and are feeling really just unsure of what to do and all of this, is reach out for an advocate support. Some school districts offer parent advocates. Some education agencies offer them to parents. Sometimes you can hire an advocate to come with you. It really just is different each location. Even having another parent there who's been through this, just to be listening with you, is always helpful as well. So, as you're getting into that IEP stage, these can be all things just to really look at and see what resources are out there. Next week during our webinar series, we'll be having some of the team members from the National Down Syndrome Congress, NDSC. They'll be joining us to talk about educational law and what your rights are with a child with a disability and what that looks like. So I really encourage you, if that's where you're kind of at in the stage or you want to know some of those pieces, check out next week's webinar for sure. This is one of the pieces that I just love. There's Owen. Oh my gosh, he was so little, you guys. I can't believe he's that little. He's a little bit older now, but that was the year that he went to transitional kindergarten. We had an amazing speaker at one of our DSDN retreats the year, I think, before all of this, before Owen was in kindergarten. And it was all about how you can set the stage with your team and set goals for your child and kind of that lifetime goal for your child, but Also making sure that your school-based team understands what your big goals are for your child throughout a lifetime. One of our moms used some strategies and resources that she had learned about Tiffany Stafford to make one of these one-page profiles. I linked to that in the bottom there too. But this can be an awesome way to just share with anybody about your child. I know lots of us use this for school-based things. So I would make one of these each year before Owen went to school, and I would share this with the new team just so they had a little sense of what's going on with him and where he's at with things. And, just to get a little bit of information. Owen's going to a camp this summer, and I actually created one for them that's a little bit different than this with some different categories, but they see a picture of him, they get to know him a little bit and see some information. I've heard just awesome things about this from educators, from school-based professionals. They appreciate seeing this as well. But as you start to consider and think about your IEPs, which will be coming up here in a few weeks that we talk about, but thinking about what your parent vision statement is for your family and for your child can be just such a real foundational piece as you think about IEPs and where you're going with all of this. I wanted to hit on just for a little bit about some advocacy resources. As you're especially in those first early years, you might feel like you're just trying to get through the days, and that is amazing. That's okay. That's exactly how you should be feeling. Some people are really motivated to do some additional advocacy during this time as well. And depending on, what's going on with your child and how much support they're needing, that can look a little bit differently. But I wanted you to make sure that you are aware of a few programs that are offered and resources that you can find. Partners in Policymaking. Unfortunately, I don't have this in my state, and I sure wish I did, because I think it just offers such an amazing set of programs and standards and information so you can really understand more about the bigger system, especially if this is something you're interested in. So it really talks you through how to be an effective advocate and what that looks like for legislative things, for school-based things, for medical things. It's an excellent program that I just hear so many great things about. I believe that's one that you need to apply for in your state. So something to just look at if that's things that you're interested in digging into. Locally, there can be so many resources that you look for too. There can be Down syndrome specific pieces that you can figure out. So whether it's a Down syndrome organization or some piece of legislation that people are looking for, or something that you feel like is important, those are all things that you can look into. The ARC is a great advocacy resource in your local areas as well. It might be at your state level, it might be locally. You can check that out, but they really work to really serve people with intellectual and developmental disabilities across the country, but also locally. You can also check into your state's IDDD council. So that's Intellectual Disability Developmental Disability Council. And that is actually a council that's appointed by your governor in your state. And they work to really serve people throughout a lifetime who have intellectual disabilities or developmental delays. So another piece to look at, they're always looking for parents to help provide voices and self-advocates on that council as well. So check it out and see if there's openings, if that's interesting to you. Thinking about national organizations when you're looking to do some advocacy, there are so many awesome resources and organizations out there. And I just really encourage you to look at each of them and see, what their missions are, what their goals are, what things they're working towards, to find the one that really best fits your passions. An example I would give you is DSDN. We came to be because we really felt like it was important that there was somebody supporting parent voices right at the beginning of the stage. Most all the other organizations across the country are serving families for a lifetime, pregnancy all the way through adulthood for their people with Down syndrome. And we felt like that beginning stage was really getting lost. And so, if you're looking to really support families at the beginning, then getting involved with DSDN would be a great fit for you. If you're more interested in school age or adulthood, then DSDN is probably not the best option for you to get your advocacy pieces together. So check out what all the organizations are doing out there and what really feels like a great fit. Ask questions, talk to their team, talk to their board, talk to their staff, find out what they're doing, follow their social media. And I think that can give you a great sense too of what their goals are. And I think just like DSDN, everybody is always really looking for people to get involved and bring new, fresh ideas and volunteer. So if it's something you're passionate about, definitely check into that. Digesting the diagnosis can be such a big piece of this puzzle as well. And some of the things I just want to make sure you're all hearing here tonight before we leave is honoring that post-diagnosis stage for everybody. And I feel like there's not even a timeline we can put on this piece, because I feel like there is quite a roller coaster of how you might feel around your child's diagnosis and what this looks like for your family over time. So, give yourself understanding and time and all of the things as you're working through this. I always tell new parents, be kind to yourself. It's just so key, especially at the beginning and throughout the different stages, because just like parenting any other child, there are going to be some easier days and there are going to be some more challenging days. So just remembering that, I think, is so key. Like I said, being kind to yourself, very, very key. Seeking out support and help as you need it, whatever meets your needs. There is no right way, wrong way, one way to parent a child with special needs or a disability. And so it's just really being aware of yourself. Like, what do you need to help you manage and navigate this and support this? There are so many people out there, organizations locally, nationally, that are here for you and ready to help jump in with resources and supports. Seeking out a therapist or a counselor, whatever it is for you to help navigate the days, that is just so key. So making sure that you understand that and know that there are times that you might need somebody to lean on more than others. And there are lots of resources out there. And I know self-care is a big thing. And this poster does make me laugh a little bit because, depending on how old your children or child is and what your self-care looks like, I think it's just more about giving yourselves those moments, even if it's going outside and taking a breath of fresh air, like any of those things, whatever that looks like. It might not be doing something super grand every day, but finding ways to just make sure that you're giving yourself a chance to breathe and process and think and have a few moments to yourself, I think is so key for all parents, but it can become more important for us as well. I want to leave you with a few more resources too here as we wrap up here tonight. Just kind of more of a reminder of some of the things that we've talked about. And then I'll look at the chat here in just a minute too. So if you have any other questions you want to put on there, I'll go through those in just a moment. Looking at your state-based resources, super important. So looking at what waivers and other programming is offered there for you, WIC, Medicaid, SSI. For example, Kate Beckett is a Medicaid waiver program that is in many states. We don't have it in Iowa, so I can't really speak to it, but I know it offers additional monies and supports to families for therapies or medical equipment, things like that. So it's something definitely to check out if you have that near you. And some key things to really remember in all of this. You really are your child's best advocates. And I know that I found my voice so much more as a parent with Owen than I had with my other children. So figuring out what that looks like for you and your family, but remembering that, you do know best, even when it doesn't feel like you might, or when you feel like you shouldn't go with your gut. At least look into what your gut is saying, because you really are your child's best advocate. And your family's journey, remember, it's just yours. So whatever somebody else is doing, it might not be the right fit. So making sure that you all feel comfortable in your family with the decisions you're making is key. Parenting is a marathon, not a sprint. I will repeat that one many, many times. It really is. As you get through each stage comes with new exciting things and new challenges. And you just have to be ready to roll with it a little bit, but making sure that you are taking deep breaths and getting through as well. and taking care of yourself, because we all know that unless, you are having some time for you and getting yourself recharged every once in a while, that it's really hard to be there for everybody else. I would say that's the thing that I have the hardest time with all of this. And I get to a point where I know that I definitely need the break, and it's probably a little bit later than I should have taken the break to begin with initially. We're going to do some Q&A pieces. I'm going to look through here just to see. I know it looks like, Christy, thank you for answering that question from the Bryants. Yes, about the resource library. That's all on our DSDN website, and you can click to it right from the parent section. It has just, the support team has done an incredible job curating all these different resources and tools and that are really targeted in the beginning stages. So check that out. They did an excellent job with that. It looks like also the question, is a social worker automatically assigned to us, and what's the process? How it happened for me, I can speak to that. I'm not exactly sure what that looks like in every state, but we actually had a social worker connect with us while we were in the hospital and just kind of start talking to us about the diagnosis in general a little bit, giving us resources, talking with us about the early intervention programming that was offered in our state that we could start accessing right away if we wanted to. I think if you aren't connected to them in the hospital, then you could ask somebody at the hospital whether they have some resources for you, or your pediatrician would probably be another great resource for that. And they can kind of get you connected. You could ask somebody about the waiver program too, if they have access to people there. And somebody else said that they, through their, I think probably IEP, Andrea, maybe, but yes. So through your IEP there, it definitely was. Any other questions as you're thinking through things here tonight? I have to use that teacher wait time. So I'm going to pop over to our last slide, and then I'm going to turn the recording off in a second. And if anybody wants to chat for a few more minutes, I definitely have some more time tonight as well. Next week is our third session coming up for our parent webinar series. And I didn't update this slide. So it's actually session 3, and we'll be talking with NDSC about disability law and education. So that session will also be happening on this same link, and it should have come through on your registration as well. And that will be next Thursday on the 21st. So we hope to see many of you then. As I also mentioned at the beginning, our goal is to get all of these recordings transcripted and captioned and maybe translated into some other languages as well, and have those available in our resource library next month. So look for those resources coming then. I really appreciate you for joining us tonight. I know it's not easy to get on a live and listen anymore these days, but we hope that it was a little bit informative for you, and then we'll have the webinars recorded for anybody who can join us later. And I'm going to stop the share there, or excuse me, stop the recording. And I am going to give anybody access to microphones too. If anybody wants to chat or ask questions, I'm happy to chat with you here tonight. I will bring my video back, but it's gotten dark here and I need a little refresh of the day. Anything else that anybody is wondering about here tonight that you'd like to chat about before we pop off?
Hi, just a totally random question. You mentioned Gigi's Playhouse, and I quickly Googled that and saw that they're opening one here in Portland, Oregon, and I don't know anything about it. Would you mind sharing a little bit about what they do or what they are?
Absolutely. So Gigi's are local playhouses is what they call it. Achievement Center Playhouses. I can't remember their whole name. If somebody else is on it, can remember, or I'm sure it's on their website, but they really, their goal is to have a place locally for people to connect that have a connection to Down syndrome. So oftentimes it's families. They have walks generally once a year where people are connected. They have a gala that they hold to support the programming. Everything that they offer at Gigi's Playhouse is free to families. So they start with sessions pretty early on, like little play groups essentially. And I should say, I'm speaking to what it's like here. We have one about a half an hour away. And so that's what ours has looked like. They have different pieces that you can do that, sorry, I'm just